regardless of how many victories we win in court, thanks to the hard work of the AG's office, we know that the President's efforts to wield federal appropriations as a hammer in order to force Washington to change our values is unlikely to stop anytime soon. Fortunately, the 10th Amendment protects the rights of states like Washington State to set public policies as long as those policies do not conflict with laws passed by Congress or the Constitution. I'm going to address several of these areas where the Trump administration is targeting specific groups or programs and detail our approach. First, reproductive freedom and health care for transgender Washingtonians. Let's start with health care. When it comes to health care, Washington State will be guided by doctors and other health care providers, not politicians in Washington, D.C. In contrast, we've seen the consequences when states do not follow this principle. Pregnant people turned away from emergency rooms or having to access health care in another state, like Washington State, because doctors are afraid they'll be prosecuted for caring for their patients. Washington State strongly supports reproductive rights, and a majority of Americans agree that they don't want the government deciding what type of medical care they or their loved ones can receive. The transgender community in particular is under attack right now, including their ability to access health care. As you know, if an individual's sex assigned at birth is incongruent with their innate gender identity, this can cause varying degrees of gender dysphoria, a serious medical condition. That's not a political opinion, that's a medical fact. Gender dysphoria is a medical diagnosis contained in the American Psychiatric Association's DSM 5th edition. Healthcare provided to treat gender dysphoria is just that. It's healthcare. In Washington State, we will not treat healthcare like a political football. Because Washington's healthcare laws will be informed by healthcare professionals, we will continue protecting access to a full range of reproductive healthcare options as well as healthcare for transgender individuals.